6 months after passage of the health care reform bill, the first wave of changes to the insurance industry have begun. Insurers will be required to offer more coverage to people, coverage that they can't take away. John Schwada takes a look at what's next.
And I think that continuing to be covered by your parents' health care is a great thing.
It's really important to have that kind of safety net.
As several key parts of health care reform were launched Thursday, the clear favorite with young adults and their parents lets young people up to age 26 piggyback on their parents' health insurance. On college campuses where students are worried about their post-school job prospects because of the economy, well, these health care provisions are increasingly popular.
I have an older brother who is still going to graduate school, and I know with this economy right now it's hard, and more children are also living with their parents and their families, so it's good to be getting government help.
Until Thursday, insurance carriers generally dropped coverage of kids when they hit 21. If they were full-time students, they'd be covered until 23. But now young adults up to 26 will be covered unless they have a job with benefits. This new protection and others took effect Thursday, hailed by healthcare reform advocates.
They mark a turning point for the insurance industry. It's no longer business as usual.
Other reform provisions rolled out Thursday, a ban on lifetime coverage limits and on carriers dropping people who get sick. Parents of kids with health challenges, like Maggie Ramirez, whose 17-year-old son has only one kidney, say raising the age limit to 26 is a protection well worth its price in premiums.
I'm very excited because, it just one less thing to worry about now. He will be insured. He will have the coverage.
In Los Angeles, John Schwada, Fox 11 News.
Good morning. I'm Ken Schuckman.
And I'm Lisa Siegel. Welcome to CBS 2 News at 11 a.m.
Our top story on CBS 2 and CBS2.com. President Obama's controversial new health care reform plan starts to take effect today here in Southern California and across the country. It adds consumer protections for more at a higher tax cost to some. Among those who now are eligible for extended coverage, college-age young adults. CBS 2's Soraya Fidel this morning is live at UC Riverside with a look, Soraya, at how the new health care reform is going to make its effects felt.
Well, Ken, some of the students we talked to here at the UC Riverside campus tell me that the new provisions will be helping their families' pocketbooks, especially during these tough economic times. You may remember this new health care reform bill came with a bit of controversy. There were some mixed reactions.
It saves me money.
Eddie De La Torre is a freshman at UC Riverside. He says having medical coverage under his parents' plan until he's 26 years old is a lifesaver.
Great. It's an amazing thing for students and basically everyone that wants to be healthy.
The 17-year-old says without the new health care reform, he would have been forced to pay a lot of money out of pocket for the university health insurance.
It saves me a lot of cash and all my friends as well.
Provisions of the new health care bill go into effect today. President Obama signed the law 6 months ago. The most sweeping benefits don't go into law for years, but millions of consumers stand to gain substantial new protections starting this fall. Insurers will no longer be allowed to place lifetime caps on how much they'll pay when their customers get sick. Consumers will have the right to appeal when insurers deny claims and win new access to preventative care without being asked for copays. In addition, insurance companies will be prohibited from canceling policies when customers get sick or from denying coverage to sick children. The law will allow parents to keep their adult children up to age 26 on their family plans. Some insurers have said they'll stop selling policies exclusively for children rather than comply.
They're going to have very, very high health care costs that are going to have to be borne out by everybody else who has health insurance. And that's a system that's simply not sustainable.
All these things are designed not to have government more involved in healthcare. They're designed to make sure that you have basic protections in your interactions with your insurance company, that you're getting what you paid for.
And under the new law, here's what you need to know. Kids can remain on family insurance until age 26. There will be no denying children for pre-existing conditions. And also when it comes to hospital care, they will be able to stay there. We are told that major changes will take place in January. When some of the new health changes do take place, you will see some major changes at the beginning of the year. We're live here in Riverside. Soraya Fidel, CBS 2 News.
Maggie Ramirez and her son Julian are among many families who are happy that insurers will no longer be allowed to deny medical coverage to children with pre-existing conditions. Julian lost a kidney to an unusual condition when he was less than 2.
But now that he's going to, be covered until 26, what a relief. That is just great.
That means coverage for regular checkups and care for 8 more years. Just one of the new provisions that takes a whole new look at what should be covered.
They mark a turning point for the insurance industry. It's no longer business as usual.
Julian is not ill now, nor are many other children with heart problems or other conditions. But as Julian knows, many are fragile and must be watched closely and regularly.
Anytime I feel a little bit weak, anytime I feel that my body's giving up on me, I have to go to my doctor and make sure that my kidney's up to date, get an ultrasound, make sure that nothing is being messed up.
The fact that children with any type of pre-existing health conditions will now be able to receive coverage will allow me to effectively manage and diagnose conditions.
Although opponents say many other parts of health care reform are flawed, most agree the provisions to prevent insurance companies from denying coverage and to provide vaccines and regular screenings for women and children may prove life-saving.
You can only live with one kidney. And so if the other kidney is not functioning properly and is not kept healthy, Julian will not be around, and I don't want that to happen. I want Julian to be here forever and ever and ever.
The good news about the effects of the provision is widely agreed upon. Its cost to taxpayers and to the government is cause for a great deal of debate. We won't know the exact impact of that for at least a few years. But I can tell you, as an ER doctor, that covering pre-existing conditions and helping to prevent instead of treat new diseases will impact millions of lives. I'm Dr. Bruce Hensel.